Hello, and welcome to Health 101. My name is Holly Cookerly, and I will be your instructor through this course. We will be using the textbook Health the Basics by Rebecca Donatelli. I do advise you to have your textbook open as you listen to the lectures, and certainly follow with the additional comments and the information that you will find within the textbook. It really is an excellent resource. In each chapter, we will be going through the learning contents. You will be seeing them on your screen as well as in your book. And also, I will not be reading them. You can read those to save time. So, health, why now? Well, we as individuals have a desire to improve our personal health, or at least consider it, maybe in times that you do not feel well. There have been global and national and community challenges that affect your families and friends. Your campus and global community we know very well in the most recent years. We live in an interconnected world where health depends on actions and the actions of others in the global community. Threats like COVID-19 does affect us all, as we all well know. The 21st century health is connected to the entire planet. We are just a plane away from whatever is going on in the world at any given time. What can you do now to change your own health prediction or trajectory? Should we invest into our health now? Is it too early? No. We'll learn a lot more about this as we go through the course. We know that good health now will have long-term rewards. Think of it as you are having a savings account, and what you're doing is making good choices now for them to accumulate into a healthier life in the future. Poor choices increase the likelihood of a shorter life, as well as persistent illness, addictions, and other limitations. So I would say very point blankly that your quality of life can be improved with good choices now. Successful aging does depend and begin now. One's life expectancy has almost doubled over the last 100 years. In the year 1900, the average life expectancy for an adult was 47 years of age. Up to a couple years ago, we had a life expectancy to 78.5 years. And now, due to the increased death rates in 2020 from the COVID-19 pandemic, life expectancy for a newborn in the United States dropped by 1.5 years to 77.3 years. In 1900, over 30% of all deaths were children under the age of 5, and it was due to infectious disease. Today, the leading cause of death is chronic disease, but what we do find that advances in treatment continue to increase our life expectancy, and life expectancy in the United States still trails behind many of the other nations. We're not number one, and there's probably quite a lot of reasons due to our lifestyle that we are not in that number one category. So personal choices affect healthy years life, and the number of years lived is an important measure of the individual's health, but it's not a matter, may not matter if your quality of life and overall health status is poor. Good health choices influence our quality of life as we age, and studies show that individuals who follow healthy lifestyle behaviors experience huge benefits. And some of those lifestyle behaviors that we're going to focus on is not smoking, limiting alcohol, eating a healthy diet, maintaining a healthy weight, and exercising at least 30 minutes per day. And this is what we're targeting in the physical health component of living well. Healthy lifestyles after age 50 add an additional decade of disease-free years compared to those who did not practice healthy lifestyle. Personal choices. We all have choices. Do they influence our healthy life expectancy? Well, let's define healthy life expectancy. It's a number of years of full health without disability, chronic pain, or significant illness. Health-related quality of life we're looking at more than just the physical. We're looking at the mental, emotional, and social functioning as well, and the impact that your health status has on the quality of life. Well-being, or we will be talking quite a lot about wellness, is assessing the positive aspects of a person's life. Health choices affecting others, well, it does affect the burden of our choices to the burden of diseases. Medical cost of obesity in the United States are nearly $191 billion each year, and this has indirect costs included reduced tax revenues, premature death, increased disability payments, and increased health insurance costs, which I think we probably all know about the insurance costing such a large amount of our budget. Smoking, exercise, or excessive alcohol consumption and illegal drug use are also placing an economic burden in our society. And during the COVID-19 pandemic, thousands of healthcare workers lost their lives treating patients with COVID-19, some of those which never really followed the precautions of vaccination or not wearing masks. So there's ethical questions that maybe we want to ponder a little bit about whether health choices, individual health choices, does affect society as a whole. And the ethical questions could be something like, should individuals be held accountable for poor choices? Or is the poor choice just a right to have? Should we require individuals to somehow pay for their poor choices? Are personal choices that influence health within our personal control? I mean, can we control the choices that we make, the decisions that we make? Some ethical questions. So let's start with understanding what health is. The medical model views health status on both the individual and biological or disease organ perspective. The public health model, a little different, views health as a result of an individual's interactions with the social and physical environment. And then we look at disease prevention or health promotion requires actions or behaviors to keep people from getting sick or injured. Health promotion is the combined educational, organizational, procedural, environmental, social, and financial support that helps us to reduce negative health behaviors and promote and maintain positive change. We will be talking about risk behaviors, which are behaviors that increase susceptibility to negative health outcomes. And also, as I said, wellness is, by definition that I use, is an active process or a dynamic process through which an individual makes choices toward a more positive and healthful existence, developing your potential to the highest level of health and well-being that you can maintain. Let's go back in history a little bit. That the 10 greatest public health achievements of the 20th century, what were they? We've come a long way, really, since the 20s when we started to have vaccinations, and in the 50s we started the development of polio vaccines. We look at some of the greatest, what I should say, the most profound illnesses that have occurred throughout history have been infectious diseases. And our emphasis on the control of infectious diseases very apparent as we look through our experience with COVID and past infectious diseases such as the influenza virus. It's a major emphasis of public health to control the spread of such diseases and affecting millions and millions of people, resulting in, such as COVID, millions of deaths. Motor vehicle safety has greatly improved. Of course, more cars on the road, but when we look about this from where we have started in the early 1900 with the birth of vehicles to where we are today, what safety dynamic changes have happened in the vehicles is profound. Workplace safety, too, a lot of regulations in place with EPA and other workplace safety programs and procedures for public health wellness. Reduction in cardiovascular disease and stroke deaths, mainly because of research and technology. We know what causes these chronic diseases, and we also know what risk may impede their or increase their occurrence, so we talk about how to prevent them. Safe and healthy foods, again, regulated, such as through the FDA. Family planning. We know more about how to protect and prevent birth, to control our population status, which could be, again, an environmental concern with maybe overpopulation. Fluorinated drinking water, again, it's safety, and recognition of tobacco as a hazardous health hazard. We've talked about several things that contribute to disease, such as alcohol, drugs, tobacco, and being able to recognize and publicly, through public health programs, help to decrease the occurrence and prevention by promoting the importance of avoiding those risk factors. So wellness and the dimensions of health, just to understand that a little bit better. Wellness is just not, as I would like to say, thinking about physical health, where we're thinking about only the way our body is working, either through prevention of chronic disease or whether we can walk, talk, think. That's physical health in one relationship or another. Development of diabetes, high blood pressure, heart disease. We think about that when we talk about our physical health. And of course, that is something that is important because usually it results physically in a health in potential death or physical morbidity. But wellness has a lot more to do than just physical health and whether it contributes to physical well-being. We look at the social health, and these are called the dimensions of health. Physical health, social health, and what that means, and very, very important, it's interdynamic with each other, that interpersonal network and successful interaction with others. Social health is very important for our general well-being. Intellectual health, as we look at that, our ability to think clearly and make responsible decisions, a key to being able to, again, live well, live healthily. Emotional health, this is probably a big one that many of us can talk about, and our ability to express emotions and maintain a level of self-confidence, because we often hear that stress plays a big part in our life. And yes, we'll learn much more about how it affects our total physical, emotional, spiritual well-being, etc. Spiritual health is a sense of meaning and purpose in one's life. We will be talking about that. It's a foundation of our meaning and purpose in our life, and how we look at caring for ourselves and interacting with our internal purpose. Environmental health, and that is, again, very impactful, often not thought about, but the world we live in, our external environment, does it contribute to our health and well-being? Do we have pollution? Do we have war in our backyard? All those things are important that will affect one's wellness and dimensions of health. If we look at the wellness continuum, maybe we can look at it and see where we would place on this continuum. Set up as a neutral point would be kind of the middle of the road here. We're showing really not any dramatic signs of health and wellness. I mean, we say we're okay, but are we excellent? Or do we show any signs of illness? Maybe not, until we get sick, maybe with some physical ailment, we might say, or we might say that stress has been profound and it's affecting many aspects of my health. That would maybe shift to the left. As you can see here on the continuum, and it really is dynamic, meaning we can go up and down this continuum day by day in our interpretation. But on the left, we look at irreversible death or disability as being the consequences or the opposite of being well, of course. So we look at this, when we start seeing signs of illness and chronic disease develops, and then it results in disability or death, obviously that is not the way we want to go. We want to show signs of health and wellness, feeling good, feeling joyful, feeling physically well, that we can move, we can think, we have social interactions with others. We do well in our environment. But of course, there is an opportunity where we can promote our well-being or our wellness by doing certain health promotion activities that can improve our health and wellness and being the best that we can be. Our optimal wellness, our optimal well-being in all those dimensions I just referred to. So as we look here we are in the middle. We're kind of like the self-responsibility. We're in control of each one of those dimensions to some degree. We're in control of our physical health in the sense of what can we do to do the best we can to keep ourselves healthy, our blood pressure good, our weight good, we can go through all those aspects. The environmental health affects us, how well we take care of Mother Earth, how well we utilize our resources that we have. Do we put ourselves in environmental situations, or are we caught into environmental situations where our total wellness continuum can be affected? Emotional health, our sense of well-being with our emotions, stress, being able to bounce back from difficult situations. Is there intellectual health? Can we think? Can we process? Can we be productive in making the decisions that affect our total well-being? Social health, the interactions with others, that we have a connection with the social world. And then spiritual health, again, is reaching for that higher being or that meaning or purpose in life. All these are interconnected and so very, very important. And we should pay attention not just to our physical health, but how each one of those dimensions affect our total well-being. So what does influence our health? There are determinants of health that are factors that influence or kind of you set up the stage for whether or not we can reach optimal health. So it's a range of personal, social, economic, and environmental factors that influence our health. Now, Healthy People 2020, as we're going to see here in the slide to come, is a plan that was developed by the government, basically, in a plan to improve the health-related quality of life and years for all Americans. With this, it gives recommendations for each of those dimensions, how we can decrease certain diseases, how we can improve our health in certain areas like exercise. There's nutritional guidelines. We'll be covering many of those in this course. It also includes strong language about reducing health disparities. Now, what a health disparity is how health is affected by things such as our race or ethnic background, our sex, our gender, our income, whether or not we have money or we don't, our health insurance status, geographical location. And yes, there's parts of the United States that aren't as healthy as other parts of the United States, and there's various reasons why. Sexual orientation, disability. We look at discrimination also in this challenge. Dramatic health disparities exist among people of certain racial and ethnic backgrounds. Men and women experience major differences in the rates of disease and disability. And by the way, your textbook goes into this further with little sidebar comments and research. All this is research-based in this course. So I'm not just giving an opinion. These are actually founded, evidence-based conclusions that have been based on lots and lots of study. When we look at the gay, lesbian, bisexual, transgender individuals may lack social support, we know that there's a lot of things that are happening in our government, politically, when we look at some of the decisions that are coming down that affect some people in different ways. Economic status can influence health. Underinsured, uninsured individuals may face unaffordable payments, so they can't afford health care, bottom line. Geographic location may limit services. And again, disabled individuals may lack services that would enhance their quality of life. So economic factors such as unable to pay for education, poor living, housing, unable to pay for food. I mean, there's definitely poverty in our country. There are people who are going hungry, not being able to afford their utilities, medication, taxes. And a lot of that comes from the difficulty with employment, or being stuck in a low-paying job with few benefits, having few assets to fall back on, just not in the inability to save. The built environment influences our health by anything that's created or modified by human beings, and the improvements such as sidewalks, bike lanes. Some of those positive changes have helped to improve some of our health quotient. There are pollutants and infectious agents, of course, that have affected the quality of air we breathe, our land, water, foods. We're talking about environmental effects as well. So, what influences your health? Our individual behavior, our choices we make affect how well our health may be. Our biology and genetics. So I want to explain, and we will get into this toward the end of the course, talking about our biology. Yes, your prospect of health and well-being in the future does play a huge part on the genes that you're born from. Should I say your background in genetics? We will be doing a family medical history so you can take a look at what you may be predisposed to. Doesn't mean you're going to get, but predisposed to certain diseases and illnesses. Yes, it is either nature or nurture, meaning your individual behavior contributes also. We almost say 50-50 prospects of developing certain diseases by what you do for your health, how well you take care of your health and well-being, and your genetics that are behind that. And then there's also social factors that seem to intertwine into this whole dynamics of what are your prospects of living a healthy life. And a long life, we hope. Good quality and long life. So as we look at the Healthy People 2020 goals, and every 10 years the government does update these, but you can take a look and go through those. Actually, if you look at healthypeople2020.gov, you will be able to see the huge manual and almost everything that we can think of, from infant mortality to drug use to environmental opportunities to promote well-being. Lots and lots of information in this. And this is where the guidelines, and a lot of guidelines come from what we will be teaching and reviewing in this course. We do know from the 2020, and the focus has been not just 2020. I've been doing this for a long time, probably since 1980. Every 10 years we look at, and this same slide has been redundant for me, is talking about lack of physical activity is a leading cause of chronic disease, physical disease, should we say. Not good nutrition, poor nutritional habits. And we look at alcohol, tobacco, and of course we have drugs too as well, as being contributory to the leading cause of chronic disease in the United States. So one of the purposes of this course that I like to focus on is how does behavior change happen? And my encouragement is, as we go through this course, that you will personally take to heed that looking at your personal health now, assessing, and actually there's an assignment that you will have this first week in assessing yourself in each of the 6 dimensions of health, and looking at the big picture of that little assignment done at the beginning of this 7-week course is what are some of the areas I'm not doing so well in those physical, emotional, spiritual, environmental, social, and intellectual domains or dimensions. And if you take a look at that, remember we're going to try to make some behavior change, or at least start with awareness that perhaps you can make some behavior changes that will improve your well-being, even in the first 7 weeks. Change is not easy. I'll underline that many times. To successfully change a behavior, you need to see the change as a process that requires preparation, that has several steps, and takes time to succeed. You really must realize that it is your responsibility. Nobody's doing it for you. And you have to, in the first step, want to make the change. So there's 2 models that they look at for behavior change. One was the health belief model. And this is where some people decide to make a behavioral health change because they perceive that there's a seriousness of the health problem. In other words, you're developing difficulty with your breathing. There's a perceived susceptibility to the health problem, meaning that if you continue to have difficulty with the breathing, it may develop into emphysema caused by the use of tobacco. There are perceived benefits to the change. I'll be able to breathe better. I'll be able to take hikes, climb a mountain, so forth. Perceived barriers that you must overcome. Tobacco is the example I'm using here, but there's many, many more that we can put in here. But tobacco is a physical, behavioral, and psychological addiction. That's barriers to overcome. We'll talk about more how to look at that as well and how to work through those barriers. And there are cues to action. In other words, you kind of wake up and you say, okay, the cue is, I'm not feeling well. I can't breathe. We can say that same analogy here, making a decision perhaps to, if you're overweight or obese, to lose weight because you perceive there's a seriousness of the problem, and or that you see your blood sugar is increasing because of the weight is increasing. And there's a perceived susceptibility to the health problem, meaning that you can develop diabetes like most of the people in the family have, and they've been overweight, and that's been a concern. There's perceived benefits to change. The benefits to change is that you'll be able to, hopefully not have to go on diabetes medication. You'll have less complications associated with diabetes, and you won't go down the same pathway of people who have complications and or disabilities or death because of the diabetes. Barriers to overcome in that situation would be diet and exercise, of course. So that's a health belief model, and for people who end up in the hospital for a chronic disease, often this is a switch that will get them to try to make some action steps to change their behavior. There's a social cognitive model here, where you look at the environment that you live in, you think about your behaviors, particularly when I talk about diet and how difficult it is when we have a lot of our food situations are usually very high in calories. We don't burn the calories up. Portion sizes are large. That's one example when I was coming off of the how to make changes in a certain situation. But I like to look at it as making a change in our behavior is a process. And this process has to do with, basically, we look at 6 stages here. A pre-contemplation stage, and I kind of get it when I think about myself and maybe wanting to exercise more, and know that I should exercise more. Pre-contemplation means that I know that I should, but I'm not really ready to make the change. I'm contemplating about it. I'm going to keep going here with the slide so you can take a look at a little bit more verbal description on this. And they have the step ladder: pre-contemplation, contemplation, preparation, action, maintenance, termination. It would be a good idea that you try to remember these. So the steps: pre-contemplation, increasing your awareness. That's step 1. Number 2, contemplation stage, where you're actually identifying a target behavior. I'm going to exercise. Learn more about the targeted behavior. Okay, what does it mean to exercise? What are we talking about? Are we talking about what is recommended? Gov.org recommends 30 minutes a day of physical heart pumping, cardio, respiratory activity. Well, okay, I'm learning more about that. Assess my motivation and readiness to change. Remember I said you want to change, but are you motivated? Are you ready? You know, there are times that it just hits you in the side of your head and say, I'm ready to make that change. Develop self-efficacy and cultivate an inner locus of control. What that means is, yes, I'm motivated, I'm ready, and I'm going to do it. I'm going to get her done. So I'm contemplating that change. I haven't started, but I am contemplating. I'm starting to set a goal. And step 3 is preparation, where I'm setting that goal. A realistic goal is one that you can truly achieve, such as I am going to walk 30 minutes a day. I'm going to do it in the morning as I have the time to do it, and I am more motivated, likely to succeed. I'm going to anticipate barriers to change, such as I didn't say I'm going to walk for an hour. Overambitious goals often sets us up to fail. Self-defeating beliefs and attitudes. I can't do it. I can't do it in the winter. I don't know where I'm going. I don't think it's safe. Is this true? Is it not? Can I set myself up to be able to succeed and overcome those beliefs and attitudes? I don't have time. Failing to accurately assess your current state of wellness. Can I do it? Am I in shape enough to do 30 minutes? Or do I start 15 minutes? And do I work myself up to that goal? Lack of support and guidance. In other words, having a team behind you, maybe to encourage you to go out there, exercise, or somebody to be able to support or be accountable to. And emotions can sabotage your efforts and sap your will. Do know that, such as the emotional dimension, you could be stressed and just have that very lack of self-efficacy or locus of control because of what is overwhelming you more. Know that that can happen, but also set yourself up with something or a talk or a goal that will take you out of that emotion sabotage. When you write your goals or sit down and use your goals, this is really a very important step. Use SMART goals, writing it as a SMART system that is not debatable, is not vague. Unsuccessful goals are vague, open-ended. Successful goals are SMART, where you're specific. What you're going to do, you're going to be able to measure it. Like I said, 30 minutes was the exercise. Specific, I'm going to walk 30 minutes. Action-oriented is the walking component. I can even get more specific at a 3-mile-per-hour rate or 4-mile-per-hour, which is brisk walk. Realistic. Is it realistic that I'm going to do it every morning or 3 times in the first week or 5 times? These are flexible to change, but they're not vague. You can always update and make your new goals at the end of each period of time, a week or whatever you need to do to be able to get yourself maybe perhaps able to accomplish your goal. And time-oriented is not debatable when you do time-oriented. When I say 30 minutes, I'm not only being specific, but I'm focusing on time. Time is a relevant commodity that is often a commodity where we get challenged with. Anticipate the barriers to change. Enlist others as change agent. And these are people that are going to help you with social contacts. I mean, walk with another person. Watching other people being successful is a great motivating strategy to look at somebody who did it and having that faith that you can do it too, such as family members, friends, professionals. Sign yourself a contract. Sit down and for taking that step to change, action-oriented, that you're actually visualizing the new behavior, you're learning to counter or substituting by a desired behavior for an undesired behavior. Control the situation, change your self-talk, reward yourself, journal, deal with relapse. Usually when you start in preparation, you start exercising, or whatever it be in the behavior change, whatever, you have to be positive. Positivity, think you can, you will. Think you can't, you won't, okay? And so when I think about this I know that there is a kind of like a point where either you get bored or you're not seeing the results you want to see, whatever. Usually happens when you make a behavior change. You stick with it for about the first 3 weeks and then you start faltering sometimes. Yeah, this is really important for you to realize that this is a normal evolution, evolvement of making a behavior change to become permanent. If you get past that 3 weeks and you get to the 3-month stage, you know that particular action-oriented behavior is starting to become a habit. Your last step, and actually they don't really talk about that in the last step, but if I have to say anything about, if you get to that past 3 months, you're getting to the 6-month stage, that behavior is starting to be a habit. Think about if you're a very devoted and 100% of the time seatbelt user. Probably when you first started, you needed to be reminded, and those reminders got reinforced by either your parent or somebody else telling you get your seatbelt on. And you started to do that and associating it with the next behavior of turning a vehicle on. Now at this time, how many of you are really thinking that I don't even have to think about putting that seatbelt on anymore, because honestly, it's just part of a routine habit that I have. Just as much as it may be as putting your socks and shoes on. You know how to do it. You don't even think about doing it. Sometimes we don't remember we did certain things until we're in the situation of doing it. But habits become enshrined, just like the bad habits we have. So what can we do to get ourselves working into that right direction? The example of the completed behavior change contract is in the back of your book. Your first assignment is to do the analysis of your current health status, where you're looking at the 6 dimensions. You're going to pick out a couple behaviors that you would like to change. Please follow the grading rubric. You will get a good grade if you do. And then you sit down and you do a plan of change, a plan or a contract. What do you plan? How do you plan to do it? By writing as SMART goals with each one of those examples of what you would like to concentrate on, at least in these first 7 weeks, and you may certainly maintain it for the rest of your life. So let's get started. After acquiring the skills to support successful behavior change, you're ready to apply those skills to your targeted behavior. I do not expect you to know what they are this first week, but I do hope that in the next 7 weeks as we go through this course, you will develop those, know those behavior skills, lifestyle changes that you could improve for your targeted behavior, and of course accomplish them for a goal of living well. Put your contract somewhere so you can see it, to review it, and make changes where you need to. But maintain not only your values and belief that you can be positive, and away you go. I hope you grow in wellness in these next 7 weeks, and I look forward to teaching you through the next course chapters. Thank you.